Well, obviously, it's a cruel calculus whether to open the economy and save people's incomes or to increase the number of deaths by opening the economy. And what's terrifying about what the president just said there, he said that this new study, which predicts a doubling of US deaths, 60,000 more deaths in the next 3 months. So the problem with what the president said is that, one, this is the model that his own administration is using. This is coming from the Institute for Health Metrics and Evaluation at the University of Washington. And secondly, with all respect to the office of the President of the United States, President Trump is just wrong. This new evaluation that says we're going to double the deaths does take into account mitigation efforts. In fact, it specifically says that we've raised the death projections because of changes in mobility and social distancing policies. Now, to give you a sense of this cruel calculation, listen to the governor of New York, where he's talking about the kind of pressures that everyone's under, from the president to the Prime Minister of Australia and everyone. It's the economy versus lives. Listen to Governor Cuomo.
The faster we reopen, the lower the economic cost, but the higher the human cost, because the more lives lost. That, my friends, is the decision we are really making.
And as the face of the president's own coronavirus task force, Dr. Anthony Fauci said, the measure here is simple, just exactly how much human suffering are you willing to endure to return to some kind of sense of normal? So, look, the cost of this shift in reopening by at least 30 or 40 states, I'm afraid we're going to see tallied in funerals. And then meanwhile, as a fun fact, I just want to say that the FBI, the Federal Bureau of Investigations, just announced that applications for gun background checks are up 41% this month on the same month last year. So that tells you about how people are feeling during this pandemic, Laura.
Yeah, absolutely. There's troubling new reporting on how this virus might be affecting children as well.
Yeah, so we saw an early flag or report, a warning come out of the UK. We're now seeing it being reiterated by the New York City Department of Health, its Division of Center for Disease Control. Okay, right now in New York, there's 15 kids from the age of 2 to the age of 15. 5 of them are currently on life-saving ventilators. Now, most of these kids either have the coronavirus or they've had the coronavirus. Now, what's happening in tandem with that, with this 15, and what the alerts are about, is that somehow or other, with these kids with COVID, it's also triggering something. It's like toxic shock, or what they call a Kawasaki syndrome. It's a inflammation of the blood vessels, including the coronary arteries. And it's potentially lethal. So we've already seen more than 270 kids infected with COVID in New York City or New York State. We've seen about half a dozen die. This is adding yet one more concern to the health of our kids, that it may be inducing toxic shock. Meanwhile, we have 2 new global studies, one from China, one from Germany, which say that we all know our kids are little human petri dishes, but it may be kids who are asymptomatic who are spreading it within their house. So, even our children are not as immune from this as we hoped they were, Laura.